APGO Educational Topic Number 26, Intrapartum Fetal Surveillance. The goal of intrapartum fetal surveillance is to detect events that occur during labor that could compromise fetal oxygenation. Fetal heart rate monitoring is a modality intended to determine if the fetus is well oxygenated and will be the focus of this video. In the United States, 85% of labors involve electronic fetal heart rate monitoring. Electronic fetal monitoring may be performed externally with a Doppler device or internally with a fetal scalp electrode. The objectives of this video are to describe the techniques of fetal surveillance and to interpret electronic fetal heart rate monitoring. Here is a fetal heart rate tracing. The top portion is the fetal heart rate, and the bottom portion records uterine contractions. The x-axis is time, and each thicker white line signifies 1 minute, and this blue line is fetal heart rate. This purple line is maternal heart rate. The green line depicts uterine activity, and this is a uterine contraction. It is important to approach the interpretation of fetal heart rate tracings in a systematic and stepwise fashion. The first step is to look at the baseline. A normal baseline is between 110 and 160 beats per minute. Fetal bradycardia is when the heart rate is less than 110. Fetal tachycardia is when the heart rate is greater than 160. We will move next to variability. Variability is the beat-to-beat change in the fetal heart rate. There are 4 terms used to describe variability: absent, minimal, moderate, and marked. With absent variability, there is no variation in the fetal heart rate. With minimal variability, the fetal heart rate varies less than 5 from beat to beat. With moderate variability, the fetal heart rate varies from 6 to 25 from beat to beat, and with marked variability, the fetal heart rate varies greater than 26 from beat to beat. Moderate variability is reassuring. Moderate variability is a reassuring sign that reflects adequate fetal oxygenation and normal brain function. Here is a fetal heart rate with moderate variability. The heart rate fluctuates between 6 to 25 beats. Decreased variability is associated with fetal hypoxia, acidemia, tachycardia, or fetal CNS and cardiac anomalies. Drugs that depress the fetal CNS system, such as morphine or magnesium, can also cause decreased variability. Decreased variability can also be from a prolonged uterine contraction. Here is a fetal heart rate tracing with minimal variability. The fetal heart rate fluctuates less than 5 from beat to beat. The next step in the assessment of fetal heart rate tracing is the characterization of accelerations and decelerations. An acceleration is an increase in the fetal heart rate from the baseline. Decelerations are visually apparent decreases in the fetal heart rate. This clever VLCHOP acronym can help you remember the different types and causes of accelerations and decelerations. V stands for variable deceleration. This is when there is an acute fall in the fetal heart rate with a rapid downslope and a rapid recovery back to baseline. They are characteristically variable in duration, intensity, and timing. They resemble the letter V and may not have any specific relationship to uterine contractions. V is associated with C. Variables are caused by cord compression. E stands for early deceleration. An early deceleration has a slow onset and a slow recovery that corresponds to the start and end of the contraction. E is associated with H. Early accelerations are caused by head compression. These are favorable and reassuring when seen on a fetal heart tracing. A stands for acceleration. These are transient increases in the fetal heart rate. They do not have any specific relationship to uterine contractions, and an acceleration lasts for more than 15 seconds with an increase of at least 15 beats above the baseline after 32 weeks estimated gestational age. A is associated with O as an OK, meaning that the presence of accelerations is a reassuring sign of fetal well-being. L stands for a late deceleration. A late deceleration is a symmetric fall and rise in the fetal heart rate tracing that begins at or after the peak of the uterine contraction has ended. The descent and return are gradual and smooth. A pattern of persistent late decelerations is non-reassuring. L is associated with P. Late decelerations are caused by placental insufficiency. Here is another fetal heart rate tracing, and the arrows depict the accelerations. The heart rate goes above the baseline greater than 15 beats and lasts more than 15 seconds. This fetal heart rate has the characteristic V-shaped variable deceleration. The heart rate goes rapidly down and rapidly back up to baseline. Here is an early deceleration with a slow decrease and a slow increase back to baseline, and it occurs at the same time as the contraction. This late deceleration has the same slow decrease and slow increase back to baseline, but it occurs after the contraction has occurred. We've now reviewed the steps for fetal heart rate interpretation. We use these tools to classify fetal heart rate tracings into 3 categories: 1, 2, and 3. Category 1 is a tracing that has a baseline rate between 110 to 160 beats per minute, has moderate baseline variability, no late or variable decelerations, early decelerations may be present or absent, and accelerations may be present or absent. Here is a Category 1 fetal heart rate tracing with a baseline of 130, moderate variability, and a nice acceleration. Category 3 is a tracing that has absent baseline fetal heart rate variability and any of the following: recurrent late decelerations, recurrent variable decelerations, bradycardia, or there is a sinusoidal wave pattern. A sinusoidal pattern is very unusual and is ominous. It is characterized by visually apparent, smooth, sine, wave-like undulating patterns in the fetal heart rate baseline with a cycle frequency of 3 to 5 per minute, which persists for 20 minutes or more. A sinusoidal pattern requires immediate delivery. Category 2 tracings are everything in between Category 1 and 3. Here is a Category 2 fetal heart rate tracing. There is moderate variability, but she is having variable decelerations. A Category 3 tracing is an indication for immediate delivery. This fetal heart rate tracing demonstrates a Category 3 tracing for there is absent fetal heart rate variability and recurrent late decelerations. The team should be moving towards immediate delivery. This concludes the APGO video on intrapartum fetal surveillance. We have reviewed the techniques for fetal surveillance and the steps for interpreting electronic fetal heart rate monitoring.